Just like with any vaccine, the COVID-19 vaccines don't come without side effects, but Dr. Reena Mehta joins us with a look at some of the most common ones. Good morning, Dr. Mehta. And you and I we had a chance to talk before we started this interview, and you just informed me that you actually just got the vaccine yourself. So before we talk about the side effects, how are you feeling this morning?
Oh, I feel great. I got the vaccine yesterday morning and, a little bit of soreness in my arm. I was a little tired last night. I feel wonderful today. And so it really almost feels like a key to freedom.
And I was going to say twofold. You are a healthcare worker and you got the vaccine. So what are your thoughts, your feelings now that this vaccine is here, available, and you were able to get the first dose?
As a healthcare worker, this has been a really hard year. And so I think, thinking about myself and many of my colleagues, we are just so excited to have a light at the end of this tunnel. I never thought that I would have such an emotional reaction to a shot, a positive emotional reaction. But it really feels like, in a few months, we may be on the other end of this thing.
Well, I'm glad you're feeling well, and I'm glad that you all are feeling much more hopeful now that this vaccine is out and being administered. And you just mentioned your arm soreness, a little bit of fatigue, some of the side effects that could come with getting the COVID vaccine, correct?
Exactly. So, when we think about getting a vaccine, there's two things to think about. One is side effects and one is adverse reactions. So side effects is what's expected. It will happen with any vaccine, even the flu shot or the shingles shot. And so thinking about side effects, it may be things like, you feel a little bit soreness in your arm, you have a headache, you may have some fatigue or low-grade fever, but these symptoms are usually temporary. They go away within a day or two. And so when you're thinking about getting the vaccine, you sort of have to weigh pros and cons. You might feel bad for a couple of days, but the gain is that it's protecting you against this very deadly virus.
And then compared to the adverse effects, that's when we talk about people having allergic reactions, and we have had reports of allergic reactions in healthcare workers in the United States and in the UK. Can you talk about that? And as far as people with allergies are concerned, should they be concerned to hear these things?
So adverse reactions basically mean it's something that's unexpected. So you don't think that something will happen, and it may. And so the chance of having an allergic reaction to a vaccine is typically in the range of 1 in a million. So it's really, really rare. So now we've seen it in a handful of people who have gotten the Pfizer vaccine so far, where they may have allergic symptoms or even to the level of anaphylaxis, which may be a severe allergic reaction. And some of these patients needed an EpiPen, but all did incredibly well afterwards, and everybody has recovered. And so the question becomes why is that? And so the thought is that there may be an ingredient in the vaccine specifically called polyethylene glycol, which is seen and used in many medications as well. And so the question becomes, and more research needs to be done, is that the ingredient that caused the allergic reactions?
But if you have any food allergies, you should still get the vaccine, correct?
Exactly. So, having an allergy to one thing doesn't mean an allergy to another. So if you have a food allergy or an environmental allergy or pet allergy, that doesn't mean that you'll have an allergic reaction to the COVID vaccine. And so the CDC has put out some guidelines that basically suggest that if you've had an allergic reaction to the COVID vaccine, then no, you shouldn't get it again. However, if you have other allergies, such as food or environmental, you can safely receive the vaccine. You might just decide to get it in a medical facility where you could be monitored for 30 minutes afterwards to make sure that there's no reaction. But people with allergies can still safely get this vaccine because the rate of reaction is rare.
Dr. Mehta, we appreciate your time. Glad you're doing well after the vaccine, and again, so happy that you feel so hopeful after that shot has become made available.
Great. Thank you so much for having me.
No
Happy
problem.
holidays.
Same to you and your family. All right, guys, the time now.